Move on. Then after that, you come to the axilla. In the axilla, we also palpate for lymph nodes. To examine the right axilla, you take the patient's right hand, you shake with your own right hand. You abduct the hand to expose the axilla, and then you lay the patient's upper limb on your forearm. Now you have access to the axilla. You palpate systematically. You start from the medial wall of the axilla. You rub that place against the bone to see if there are palpable lymph nodes. Then you come to the anterior wall, which is this fold of muscles extending from the chest to the humerus. Are you following? So you go beneath them and try to rub against that place to see if there are palpable lymph nodes. Then you come to the lateral, which is against the humerus. You rub against it. You feel to see if you can palpate any enlarged lymph node. Then lastly, not lastly, you now also go to the posterior wall. Are you with me? The posterior wall is also formed by folds of muscles, latissimus dorsi, that is extending to the humerus. So you palpate that place against it to see if there are enlarged lymph nodes. Then the central area is the central region of the axilla. You feel it to see if there are lymph nodes enlarged in the central group. Then you now poke your finger in to get to the apex, the apical group, and you feel to see if there are lymph nodes. After doing the right, to do the left, you shake the patient with your left hand, you abduct and place the patient's limb against yours. Then you have access to the axilla. So you check first the medial, the anterior, the posterior, the lateral, the central, and apical. Is it clear? After that, you come to the epitrochlear group. You hold the hand like this, about the wrist. You raise it up, and you use the pump of your fingers to feel around your olecranon and the trochlear bone to see if there are enlarged lymph nodes there. You also do for the other hand. Then after that, you now come to the hand. Remember, I said we are working from the head downward. For the hands, you place both patients' hands like this. You put your hand in between. First thing, you assess for palmar pallor. Assuming that you are okay, you compare the patient's palm with yours. You should be seen comparing both. Is it clear? Is it clear? You should be seen comparing both. After that, you turn the fingers and look at the dorsal aspect of the fingers. You look at the nail bed and observe for peripheral cyanosis. If there is peripheral cyanosis, you see some blueness in the nail bed. Then after that, you check for capillary refill by applying pressure on a nail. It will blanch. Immediately you remove your hand, it should become red again within seconds. Is it clear? That's how you check for capillary refill. The last thing you do with the hand, you squat and you look at eye level to assess for finger clubbing. Most patients in surgery will not have finger clubbing, but if you do find, like they teach you in medicine, you can begin to grade, but most patients will not have. After the hand, you now come to the axilla. Because of the kind of patient we are using, we cannot, sorry, I said axilla, the groin. You come to the groin. For the groin, we assess for inguinal group of lymph nodes. The place to check for them is at the medial aspect of the thigh, just below the inguinal ligament, around the femoral triangle. Do you understand? You palpate both at the same time, somewhere around here. Do you understand? So you feel for both at the same time. Then after that, you come to the popliteal group of lymph nodes. You do one at a time. To check for one, you flex the knee, dig your fingers into the popliteal space and feel for the lymph nodes. Then you do the other, you flex the knee, you dig your finger in and feel for popliteal group of lymph nodes. Then after that, you come to the feet. In the feet, you check for pedal edema. To do it, you use your tongue. You use your tongue. You cannot use your index finger. You won't get any mark. You apply your tongue on the bony prominence over the mid part of the feet. Are you following? You look at the patient to be sure you are not causing him pain. After applying pressure for some seconds, you look at it to see if there is any depression, or you feel to see if there is any depression. If there is no depression, that means there is no edema at that level. But you don't stop at that. You come to the malleoli. Using your thumb and index finger, you palpate the malleoli. Look at the patient and apply some pressure. After some seconds, you observe. If you don't see anything, you feel. If you can't find edema at this level, there is no need to continue. Is that clear? But if you find edema here, you will now continue. You continue along the anteromedial border, where I am touching now, anteromedial border of the leg, at the same level. You continue to check while looking at the patient. You rub to see, you check, you do like that. You continue till wherever the edema subsides. Is that clear? Then after that, you ask the patient to sit up. When the patient sits up, you come to the prominence of the sacral bone. You palpate and look and see whether there is sacral edema. After that, general examination is complete. You tell the patient, thank you. Exactly.